Hi, everyone. Welcome back to Sessions with Sarah. We are here today with one of my most talked about things in the world is menopause and hormone balancing. If you've been here before, we talk about a lot about medical problems, but these girls are about to change the whole entire topic. It is a taboo word in the world, right? Ladies, introducing you to FemGevity, the ladies of FemGevity. Michelle come on, Michelle.
Wispelway, Michelle
She's got a
Wispelway.
fancy name. And Kristin Mallon. They are the creators of FemGevity, and I am so excited to talk about hormones and being fat with them. Welcome to the show.
Thanks so much for having us, Sarah. So fun to be here with you.
Everything's going to be a good time. We should have just brought cocktails with us too.
Yeah.
I'm always down for that. It's almost 4 cocktails.
Yeah, right? On a Monday.
Cocktails go good with everything and everything.
Absolutely. Absolutely.
Yeah, totally.
Now,
I wonder what cocktail would be the menopause cocktail. We should make that,
You should make one for your MTV.
Like a hot flash or something. And then I was a bartender for a while, so I'm like, what would be in it?
Let's see.
Something like
pink.
Fireball, maybe.
Yes. A little something pinky.
Yeah, a little cranberry juice with Fireball and now that's like cinnamon and cranberry, so it might be like sweet. I gotta think about it. I'll come back.
All right.
I would go for a vodka basil gimlet martini up, extra cold.
Ooh, that sounds good right now, actually.
Muddled basil too, maybe.
Yeah. Sounds healthy and good at the same time.
Yeah.
So, where did you come up with this concept? This is an amazing thing. You guys can go online and make an appointment and talk to somebody about the taboo of menopause. Like I personally, this is how I discovered the girls was I've been struggling with weight gain. I can't sleep. I'm always up at 3 a.m. And this is all signs of having hormone imbalance, perimenopause, menopause. So where did you guys come up with the whole concept of doing this online?
Yeah, we kind of came about it from different places and then met in the middle on it. For me, so I've been a midwife, a certified nurse midwife since 2006. And I've been working with women primarily, they always tell you when you're in midwifery school, midwifery is from menarche through menopause with, menarche being when you first get your menstrual period.
Yeah.
And, but really midwifery is really kind of focused on birth and childbirth and postpartum and what happens around that time. But you learn I'm sure how it is in pharmacy too, you learn on the job and on the go, and you learn about women's health and preventative health and functional health and pretty much anything that you want to learn about, because your patients come in and they ask you because they're coming to you for their well women's visits and their pregnancy, and then they stay with you postpartum. So my patients started to get older because when I started in 2006, they were 30, 40, 20, 30, 40. And then they started to get older, and then they started to ask me questions. And I was like, oh, there definitely has to be a menopause doctor I could send you to. That would make the most sense. Let me find someone for you. And I started asking around. Nobody knew anybody, asking my colleagues. And, we know a lot of OBs. I know probably 200 OBs. And they were like, no, don't send them to me. Nope, not me. No, pass down the line. Hot potato. Keep it going.
I don't want to talk about it. Yeah.
And so I was like, okay, I really have to find these solutions myself. At one point I found someone, so I was in New Jersey, New York. I found someone in Connecticut. So I was sending people a whole state away. This person was booked for months at a time. It was impossible to get into them.
Right.
So I was like, I have to solve this problem. So I started working with Dr. Michael Abrahams, who is a doctor that's works with us now, and figuring out how to solve for menopause. And then not only did I figure out how to solve, I was like, oh my gosh, this is an amazing opportunity for optimal health and wellness. I'm like, there's so much to do. So we started doing it. And then it was really just no one else is doing it. There's this huge hole in the market. Women are totally underserved. And then that's kind of how I came to my side. And then Michelle can tell you how she came to her side.
Yeah. So I've been in women's health my entire career on the diagnostic lab side. And I've really always honed on what's innovative and what's next. And I really took a full dive into the femtech industry And I was
Okay.
just really fascinated on just the potential in the market, and finally the focus on like R&D and innovative solutions, and not just being trapped into our healthcare system, which is just pretty stagnant and it's very rigid, and you have to do what ACOG says, and that's it. But there's never been, well, let's step outside the box for women and just kind of redefine how we go about, sexual health and pregnancy and vaginal health, and just like talk about, like just the essence of women's health, because really like women are the primary caregivers as far as like contributing to the healthcare decisions in a home. And I was like, you know what, I'm just going to kind of dive into it. And I went to a summit to learn more about with some other founders and the products. And my thought process is very heavily around the microbiome for vaginal health. And just they're just knowing like from the diagnostic world how much there's so much like lacking on how it's treated. But at the time, Kristin was like thinking more about about this menopause deficit on how she sees it from her patients. And then I was coming from it like more of a femtech perspective. I was like, what is the next wave and the next disruptive thing for women to care in that gap? And ironically, Chris and we have known each other for a while. We had worked together, and then we always really remained friends for years after. And she happened to be thinking about her brainstorming idea, and I was thinking about mine. And we happened to just touch base that day. And I had literally, as the next day back from the summit, and then she told me, and literally the next day we met and we birthed FemGevity, and then and just like just how it was formed into the menopause vertical. And really it made me take a step back, because I have a very deep rooted situation where like my mom actually passed away unexpectedly at 51. And
Wow.
she was very really a victim of the lack of education by the medical system and doctors not knowing about menopause. She thought she was spotting for years, and her doctor's like, you're going through your changes. And long story short, my mom actually had cervical cancer that spread to her liver because the mass was so big. And I said, what's crazy is like, it was just like life just, Kristin and I say a lot, and Kristin is like the main like person who's really shown me this, is like life just happens for you, right? So it's like life was just happening for me to bring forward of something that like I suffered through and still is affecting me very traumatically, which is that with my mom's health and women's health, and bringing it to the forefront. Because fast forward to today, is how many women that we see that are like, oh, my period comes. Sometimes my period doesn't come.
Yeah.
Or I started spotting for 3 days, but then it went away. So I'm fine. And I'm like, oh my God, that's exactly what happened to my mother. And she died. So, and it's very real. And I always thought it was like my mom kind of being like careless and not looking out, but it wasn't. It took me until we, founded FemGevity and started it, for me to be like, it's our healthcare system. It's what's available to women, and the treatment and how we go about it. And, the days I thought my mom was absolutely batshit crazy, it was probably just like her freaking hormones.
Oh yeah. I feel batshit crazy all the time, and I swear to God, it's my hormones.
I love crazy.
So fun. We can be
here. Crazy time.
Well, speaking of that, right? Because like I was like, I will never forget my sister. We were like going on a trip to Disney, and I just lost it. Like I am chill, and I just lost it. And she's like, "What is wrong with you?" And I'm like, "I don't know." And then I kept noticing it happening, like even at work, because I'm a pharmacist, and I just would want to lose it on like these people that come in sometimes that drive us crazy. But it's just, I think it's a side effect of like having this imbalance. What are women coming to you guys? What is their number one concerns that you can tell them, hey, you're going through it. Let's meet.
Yeah. I mean, that's a really good question, because I think that this is like a great opportunity to kind of educate, because so many people think that menopause is hot flashes. And like Even this year, there was an ad in the Super Bowl about like vasomotor symptoms and hot flashes. And that's not the number one menopause symptom, because women experience so, like, the breadth is so wide and even the depth is so deep that pretty much, I always tell women this all the time, like, anything that you're really experiencing that's new or different or unexpected, like in your 40s, you should think to yourself, like, wait a minute, is this a hormonal change? So I would say top right off the bat, 100% night sweats, insomnia, sleep troubles, super common. Another thing that's super common is what you already mentioned, like the anxiety, depression, rage, agitation, irritability. Like, women are like, I'm not like myself. Their family and friends and partners are like, where is Sarah? I want Sarah back. Or where's Kristin? Like, what happened to you? And a lot of times it takes someone else to notice, okay, whoa, that's not like you. Like, Sarah, wait a minute. That's not how, like, your sister, like, that's not how you really are. Or a partner to be like, that's not how, that's like, what's going on with you? And that I want to just like tell women over and over again, like, that's when you should think like, okay, wait a minute. I should get my hormones checked. I should speak to a menopause, perimenopause, or hormone specialist and have someone that deals specifically with women in this time of their life that I could ask questions to. But yeah, so it's the rage, the mood changes. I would say that another really common one is like hair loss, weight gain.
The weight gain.
Like, yeah, the like sudden weight gain. They don't change a thing. Nothing about the diet, nothing about the exercise pattern changes, and then just all of a sudden they're putting on weight out of nowhere. I would say that those are probably the most common things that I see.
Okay. Yeah. It's just like, especially the bloating. I see all these products on the market and they're like, just take a probiotic for that. And I feel like that's could be helpful, but I don't really think that's the answer either. You know?
Yeah. And I think that's like, to kind of like where Michelle's expertise really comes in, because, Michelle's been in this like diagnostic laboratory world her whole career.
Awesome.
Yeah. So like, that's where like I'm on the clinical side and she's on the lab side, and like, we feel like we're 50% of the equation kind of coming together. Like, okay, your symptoms are half the equation, but what is like the laboratory testing telling you? So we do like a ton of testing on gut microbiome, micronutrient, allergy testing, sensitivity testing, genetic testing, in addition to traditional mainstream laboratory testing. And Michelle could probably tell you a lot more than I can about all of that, because that's her area of expertise.
Yeah. So the thing is, doctors are very trained, are just trained to look at your lab results and see within range. So fine. But you're not trained to actually see like what's your optimal levels, or just because the results say normal, that's not actually where you should be at. And so like to go back, circle back with like the bloating and people taking probiotics, there's so many people that are taking things that they shouldn't be because they haven't been properly diagnosed. So we do microbiome tests that really gets down to a lot of different organisms and pathogens, and your bloating could be because you have like H. pylori, or you have some type of bacteria from your stool, and that needs to be treated. And you're going to be taking these probiotics so you're blue in the face, but nothing's ever going to happen.
Right.
Or you might be having bloating because your estrogen levels are out of whack, and if your gut bacteria is not in sync, then that bloating is not going to help, even if you're on certain hormones. So, just with us we're firm believers that you cannot treat a patient until they get tested and we see what's going on, and to really understand, we're big advocates of following a lot with Peter Attia and understanding that medicine 3.0 and not just the 2.0, and really getting your optimal levels to not just treat on demand, but treat beforehand, like your savings or account, right? So this is like your savings for your health.
Yeah.
And there's just so many different levels, from next gen sequencing and genomics and in-depth hormone assays, that you really need to get down to people's cellular levels to see what's going inside before they just get an estrogen patch and to know. And that's really how we're, creating each woman treating each woman as a unique individual in innovative solutions. So,
right. Well, I have to say that is like genius to me. I don't think I know of any company that really does do testing that deep. I know there's other tests and everything, but like me, I went to my doctor, probably around all of our age. Love her, but like still my cortisol came back normal. My enzymes, everything. So it was just like, but I'm not feeling any better. So, where's my waistline? That was like my biggest concern too. And I just think that's great that you're doing that kind of testing that gets that deep down. So, I mean, that's just news to me what you told me about the probiotics. I could be taking a probiotic and I could have H. pylori. And guys, H. pylori is it's like a bacteria, I would say, that's in your gut. And you have to take this huge regimen of like antibiotics and Prilosec to kind of get rid of it for 14 days. So, there's a lot more to it. And I think that's just incredible that you guys have come up with this.
Yeah. And like, there's so much the gut microbiome can tell you. I mean, that's one of my number one tests that I really like to recommend when women are kind of like lost as to like what's going on, because we have now SIBO, which is small intestinal bacteria overgrowth, which actually became an ICD-10 code. So that's actually something that the mainstream medical community is recognizing as a real diagnosis, not just a functional medicine diagnosis anymore. But some of the functional medicine terms that are still kind of now actually really true, like we have dysbiosis, which means just kind of like the growth in the gut is kind of like overgrown. So you can kind of think of like a garden where like you have good and bad bacteria that's overgrown.
Okay.
You're not kind of tending to it and caring for it. Like it's not just about bad bacterial overgrowth. And then there's like, the term leaky gut, a lot of
yep. Yeah, you hear it a lot.
A lot of mainstream doctors don't like that term, but that like there's indications within the stool to let us know, like, is the wall of the intestine exposed, meaning that there's sensitivities that could be brewing that you didn't have when you were younger or as a child that you're now developing because you're reabsorbing too much of that in the gut. There's certain types of beta-glucomactanates, which can sometimes show us a lot about how someone breaks down estrogen. So they can actually be recycling their own estrogen metabolites. And we can find a lot of this information in the gut. I mean, it's really just a plethora of reasons and information, especially for people who don't want to go on HRT or they want to avoid pharmacological solutions. They can really get to a lot of answers and a lot of symptom relief by balancing the gut microbiome. And sometimes women are really surprised, and I'm even surprised. Like they'll be doing it because they have diarrhea or they have constipation or they'll have bloating, and we'll balance the gut, and then their skin is better, their hair is better, their nails are better, they have more energy, they're sleeping better at night. So all of the things, we didn't do it for those things, but then they have all of these other benefits. And I think that's really fun because when we balance the gut, it's like, oh, what are we like? How many more optimal things is this patient going to get because they did all this work to like make sure that their gut bacteria was in a good place.
So I actually will back that up because I had the gut microbiome test, and I have gut, the dysbiosis, and actually H. pylori too. And I have, except from this weekend, which didn't get much sleep, but I've had energy since I've been taking my regimen with just recalibrating my gut bacteria, my microbiome. And, this obviously I'm I've been on a regimen with like more vitamin D and more vitamin C, but it's definitely because of what Kristin actually put me on and treated me. I basically tied her down to a chair and I was like, help me, you're the best.
That's like me right now.
No, because we're so busy running around, and I'm like busy with the patients and with the business and everything. And then Michelle would be like, she'd be like, help me.
What about me?
It's always those closest to you that, because I love Michelle so much. I know she'll always be there for me. So
we're always there for each other. And I even get to tell her, we love each other so much that I tell her about my poop every day.
I was going to say, that is awesome. Good times. Poop conversation.
That's how you know you really love someone when
exactly.
Vaginas and poop all day, every day.
Vagina and poop. I could go there.
Yeah, there's actually something else too, like this new term that I'm starting to hear a lot, like in we're super niche down, it's something called estroblome, which is like it's the estrogen gut microbiome, and they made it into the word estroblome. So that might be something that I think people start to talk about more as we kind of go through how the gut microbiome affects menopause, because I think we'll start to see more and more the profound changes that that we're having. And, been doing it for a while, treating people, like I said, we always meet women wherever they are, wherever they're at, whatever they need. And so the gut microbiome is a really good solution for people who want to avoid any medications.
That's good to know. I think that
Yeah.
I really do think the gut has something to do with the whole estrogen thing. And what you're saying is just verifying that for me. And speaking of estrogen, not to go away from talking about poop, because that is an interesting conversation.
All day.
all day. But estrogen therapies. Now, we've talked about this before, how people are afraid to use estrogen because of the misconception of it causing breast cancer. Now, is that the case, or have things changed on that front?
Yeah, so this is like one of my favorite topics to really get into. I love to kind of go through this. So what you're talking about is something that happened in 2002. There was a study that was published in JAMA, the WHI study, which studied up 27,000 women taking HRT. And what they found actually, so what they thought they were going to find is they thought they were going to find an increase in longevity from taking estrogen. And in a lot of ways they did find that estrogen does help with cardiovascular disease, cognitive dementia and Alzheimer's, and bone loss, osteoporosis and prevention. And there were two arms in the study, a Prem-Rin study and a Prem-Pro study. So the Prem-Rin study,
I remember those babies.
Yeah, those old drugs that nobody uses anymore. Was the conjugated equine, that's right, horse urine estrogen.
Yep, I remember that. I forgot about that. That's right. I forgot about that. Yeah.
Yeah. Yep. And so that arm of the study actually found a relative risk reduction in breast cancer, believe it or not. And it was the Prem-Pro study of the arm that had the estrogen progestin combined. And it's really important to note that progestin is not progesterone. So synthetic progestin is a totally different medication than progesterone or micronized progesterone or bioidentical progesterone. So we don't even use these medications anymore to treat women. I mean, very rarely, every once in a while, we'll get someone who's on Prem-Rin and we're kind of like, oh my gosh, wow, like this doctor is probably like 70.
Where did they even get it? It's my question.
So that study found that the estrogen study of the arm actually had a relative risk reduction lower. So, and I can't remember the exact numbers. I don't want to be misquoted, but I think so relative risk, if it's 1.0, I think it was like 70.77. And they found that the Prem-Pro arm had a relative risk increase in breast cancer over the long term. It went from 1.0 to 1.26, which actually is not considered statistically significant. So let me back up.
That sounds small. It doesn't sound like a huge.
Yeah. So let me back up and kind of explain. So what that means is they found that instead of breast cancer affecting 3 in 1,000 women, it was affecting 4 in 1,000 women that were on Prem-Pro. So just like a hint of an increased risk. And they didn't even consider it to be statistically significant. The results of the study did not consider it to be statistically significant. Actually, there's a study that was done a couple years prior, a nursing initiative study that was done with even more women, 30,000 women, that did not find the same findings as an increased risk in breast cancer. So anyway, a long story short, this study was published in 2002. One study halted the use of HRT across our entire country. I mean, literally 1 second to the next. And we've never had anything like that in medicine ever again.
Okay. Yeah.
And this is something that, doctors like Dr. Peter Attia, and, we believe this, our chief medical officer believes this, doctors like Dr. Avram Blumring, like really big prominent leaders in this field, believe this was like the single biggest point of incompetence in medicine that we've had in the last 100 years, is that we've denied women, probably about 4.5 to 5 million women, HRT in the last 25 years because we've gone through this inaccurately saying that estrogen causes breast cancer. And it's still happening today. I mean, we see women all the time that are like, well, I don't want estrogen. I don't want estrogen. I don't want to get breast cancer.
That would be me.
Yeah, exactly. And not only did it miseducate the masses and miseducate like Generation X and even millennials, I think this entire generation of women are totally uneducated about estrogen, but it miseducated the medical community too. So I graduated in 2006.
Okay.
So I graduated 3 years after this study, or 4 years after the study really came to light. And when I was in school, and I went to Johns Hopkins, I went to one of the best medical schools in the world.
So you smart.
They told us that, well, you know, I cheated on my test to get in. No,
Watch, they'll be like looking you up.
Yeah. Johns Hopkins is going to call me now. They're going to be like, we need to talk to you about your transcript. They didn't educate us, and they didn't educate my OBGYN counterpart. So we had decades of not being educated about menopause, because they were like, well, there's nothing to do. There's nothing to treat them. Like, there's nothing to teach you, because, okay, this is menopause. This is what happens, but you can't give them estrogen. You're going to kill them.
So just suffer.
Exactly. So not only were consumers and women totally in the dark and uneducated, but the entire medical community was uneducated for probably 2 decades. And we're just starting now, I mean, in 2023, to climb our way out of what that study did. And if you read Dr. Avram's book, he wrote this fantastic book that I always recommend if anyone's ever considering or not sure about taking estrogen specifically, because there's many other choices when you're talking about menopause too. I mean, we do progesterone, we do testosterone, we do DHEA, we do all different types of phytoestrogens, lots of different choices. So before you even get to estrogen, as like you have to go on this to kind of manage your symptoms, there's a lot of other alternatives first. But he wrote a book called Estrogen Matters, where he kind of breaks down every single study before 2002 and every single study since then, and is like, estrogen does not cause breast cancer. And he was a hematologist, so like a blood oncologist, and his wife had breast cancer. And so it's a pretty powerful book to read. And I highly recommend it if anyone who's like severely struggling and is worried about the estrogen breast cancer correlation, that they get the book, because estrogen might really be really helpful for them and help them along. Also, good things to remember is that estrogen in that study, which reduced breast cancer risk, was conjugated equine estrogen, which we don't use anymore. And there's really 3 different types of estrogen that we kind of use: estrone, estradiol, and estriol. And so those 3 different types of estrogens are used very differently. Estradiol is the most commonly used estrogen, although estriol is the estrogen that the placenta makes in pregnancy. And so we already know that that's safe. We already know that things like pregnancy don't increase the risk of breast cancer. Women that actually have more pregnancies actually have a reduced chance of having breast cancer. So we know that estriol is very, very different from estradiol and can be very different from estrone as well. So it's not even just estrogen is like this catch-all thing, that there's different types of estrogen within the estrogen family. So that's why going to a specialist like FemGevity or like us is like, we just really just think it's so important, because there's so many intricacies and so many details that really go into it.
That's incredible. Like, this is all like new knowledge. I feel like my listeners should listen, because, you know, you guys know what you're doing. Let's be honest, right? You know, and like somebody like me who has Alzheimer's in my family, and my mom always had, you know, bad bone densities. You know, having something to protect me going into the future, I think that is essential. I think that's great, and I wouldn't want to suffer. So if there's something that you can do to make yourself not feel like the way I feel every day lately, you know, why wouldn't you do it? I mean, it's so affordable to go and have these appointments with you guys. Could you guys tell them a little bit about how they can go to your website to sign up for an appointment?
Yeah, so they could go to femgevityhealth.com and you just click on Get Started, sign up now. and it will bring you through the whole patient flow, and you could select your appointment time, the day. And one of the most important aspects of our flow is that we have a very in-depth health questionnaire, and it is a little bit longer, but you do not have to do it at the time of setting up, booking your appointment. You could do it later on, but that gives us all the information to really properly treat you and know what's going on in your family history and what you have been through, when your mammogram was, your pap, and if you've had any bloods recently. And we have a portal that you'll be able to track your treatment plan. Everything's telemedicine. So we have the video. We also have live chat and text messaging.
Awesome.
So you have 24/7 access with not someone overseas, but actually with us. Kristin and I even answer them sometimes.
Amazing.
Director of operations, our nurses answer them. So you get that full concierge feel at affordable prices with your care. So, and all of our social media is at FemGevity is our handle.
Yep. And it is super affordable. Like I was looking at the pricing and I was like, this is only $145. Like, you don't accept insurance, correct?
No, but you can. So we do participate with, one of our lab partners. They're a network with insurance that you can use for your hormone assay.
Okay.
Now, we can't speak for people that have co-pays and co-insurance and deductibles, but that's really the only part of it that you can try to put through the insurance. But
okay. Well, that's good. I mean, labs are expensive, so that's nice that the insurance does pick that up.
Yeah,
right?
the genomic assays and the gut microbiome and the allergy and the epigenetics and nutrigenomics, those are out of pocket, and which is, to be expected for that type of care and those types of
more
tests.
intricate. Yeah. But seriously, $145 to meet with a practitioner 3 times to make yourself feel better and have literally one-on-one concierge medicine, especially when you're going through perimenopause or menopause, I think is just a great price point myself. I mean, I did my first visit. We're just waiting for Sarah to suck it up and go get her labs done.
Now, let us help you feel better, to live longer and live better. And
absolutely,
if you're not sleeping, you want to sleep to prevent that Alzheimer's and dementia.
That's like a new thing. I hate not sleeping. I don't know though. It could sometimes have to do with this little guy here, little Leo.
Leo gets up and Leo keeps you
look
up.
At Leo. You get up, don't you, in the middle of the night? Yeah.
Maybe Leo wants to go through FemGevity too to help.
Maybe he does.
Does he need a shot of tea?
Yeah, he definitely does. He snuck in as we were talking, so I just picked him up so he didn't make any noise.
So cute.
Yeah. But well, thank you so much, you guys, for sitting here and talking to me about one of the most taboo subjects out there. I think that you guys have hit all the nails on the head and you are there. And I think the more that people talk about it, I see what you guys put out on social media. You guys have something called MTV, Menopause TV.
Yes. Yeah. So MTV, which, I'm sure anybody who kind of remembers the 80s will remember MTV and the videos, but we do live and answer questions. So sometimes if you're not sure, or you just kind of want to get a few questions answered, you can come on at 8:30 Eastern on Monday nights and 5:30 Pacific time. And then we're answering questions usually for 20 minutes to a half an hour.
Awesome.
Depends on how many people are there and how many questions come up. Also, you can send questions in ahead of time. So if you can't come at that time, when we put up on our IG Live, so usually sometimes during Monday, we'll put up on IG Live, we're doing MTV tonight, and it's at 8:30. And then the questions in the comments, you can put questions in the comments and then we'll answer those questions on the live.
Awesome. That is awesome. So if you guys have any questions, make sure you join them on Mondays. But seriously, for all my listeners, make sure you head to femgevity.com. You'll probably hear me talk about it all the time. And seriously, if you're feeling any of these symptoms, I know we're having fun and joking around, but if you do feel the way that I have been feeling, or how they have been discussing how a lot of patients feel, make sure you go there because it's so affordable. It's worth putting the investment into your health. Thank you so much, you guys, for joining me today. This was a great conversation, and come back anytime. I'd love to have you.
Thanks, Sarah. Thanks so much.
All right. This has been Sessions with Sarah, and I will see you guys very soon. Bye.
Bye.